The last two episodes we've talked about pregnancy, the first trimester, the second trimester, but now you want to find out what exactly happens during the third trimester. Whether you are a mom who is pregnant, whether you're looking forward to ever getting pregnant, you have a sister or a mother or even your wife. This is very important for you to know because it is the last stretch to this journey of pregnancy. And Dr. Maranga Orora is taking us through that. He's a seasoned gynecologist based here in Nairobi, Kenya, and you do not want to miss this. Remember, if you have missed the two episodes that we've already done, that's on the first trimester and the second, make sure you watch them because this is a continuation of what we have been doing. My name is 𝗍𝗿𝗲𝗽𝗍 Nzukhi. Welcome to the Purity Afya Show, and you kickstart with a welcome note from the doctor himself because the last trimester is now telling a woman that you're almost at the end of the road because it's not easy. So how do you know, when does the third trimester begin and when does it end? Because most of the time you're told baby can come anytime.
Thank you, Purity, for inviting me back again for this show. I want to welcome our viewers also. So, third trimester, Lala Salama. So, it starts from 32 weeks all the way to delivery. Now, delivery is usually at 38 weeks. We shall say 38 weeks up to around 40 weeks, but there can be plus, minus, something like 2 weeks or thereabouts. So a number of women will usually be quite anxious about it, and rightfully so, because now they're expecting going towards the end of their pregnancy, wondering how it is going to be, whether it's going to be normal delivery, whether it's going to be a CS, and especially for the first-time mothers, how do you prepare for it? How do you prepare that the baby is coming? And how would you know, like, for example, labor, it's your first baby. How will I know? That's the question we are asked most of the time. How will I know that I'm actually going into labor? Then you will tell them you're likely to have labor pain. It's like, yeah, I've been having these pains. What's the difference? Which is true. A number of times you would be having like discomfort, stitches, what we call Braxton Hicks contractions, which is basically the uterus trying to practice for the eventual labor pain. But what we usually say now, I'm sure I'm going ahead of you, ahead of myself, in terms of the signs of labor. What are the signs of labor? It's that labor pain. But this pain that is coming is like none other before. It is generally very severe, and it's not continuous. It would usually start pole. So it takes like a few seconds, and then as time goes by, it keeps on increasing in intensity. And it may now start coming like more often than previously. So it may come like every hour, every 30 minutes, every 20 minutes, every 10 minutes, every 3 minutes. And every time it comes, it's more intense, it's more severe. And it's usually the lower abdomen, and it goes to the lower back, and then it starts now going to the thighs as the intensity continues. Now that is the labor pain. As compared to the stitches whereby one feels a stitch, you rest, you change position, and it goes. For this one, it will just continue. Yeah. The other sign of labor, or labor pain, so to speak, as we generally put it, is the show. Well, what we mean by show is there is, we call it a mucus plug, which has been on the cervix for 9 months. Protecting the baby from the outside, and then it basically, and then there's passive dilatation of the cervix, so it falls off. When it falls off, this mucus comes out with a bit of blood. So you find a mother going to maybe to the washroom, wiping herself, and then she sees this mucus with some blood. That's what we call a show, and it's a sign that labor pain or labor is almost starting. And generally after that, 3-4 hours, generally the pain has set in. And thirdly, you may have the waters breaking down. So there's this balloon where the baby has been suspended for those 9 months, and then suddenly it breaks. The waters drain out, and it's usually a lot of water, a lot of fluid coming out. And that's also a sign that now the baby is almost coming out. When the waters break out, it is usually the pain may start around, a few hours after that. So in other words, what you're saying is any of this can actually start with no particular order at all. That's how a woman will know that this is actually the day the baby is likely to come out.
All right. And during the third trimester, if a baby comes, whether at the beginning or at the end, what are the chances of survival for that baby?
It used to be very precarious. Previously, a baby coming too early, even if it's third trimester, 32 weeks, used to be a bit dicey. It still is. It depends really where one is. In Nairobi, and you go to a good facility, the baby will survive. That's 32 weeks, 33 weeks, 34 weeks. The baby will survive. But they'll need a specialized doctor, a pediatrician, a neonatologist. Those are the doctors who are specialized in very very premature babies. But when you talk about 36 weeks going onwards, these are mature babies, and most often, unless otherwise, they'll survive.
So what are some of the signs, or let me say discomforts, that are normal that women should expect during the third trimester? Because any discomfort is like I'm in labor.
As we said, there are these contractions which will come on and off, more like stitches really. And for most mothers, they'll actually realize that I'm feeling this pain. Nasikia ni kama nimekanyagwa. Na unajishika unasikia yenyewe hii ni mguu, most of the time ni mguu ya mtoto. So you actually feel like, and then the baby moves. So for as long as the baby is actually putting pressure on that particular area, you'll feel that pressure and therefore pain. When the baby moves a bit, the pressure will go or get transferred to a certain other area. Of course, that is different, and mothers will generally understand that this is not labor at all. But there's also the so-called Braxton Hicks contractions, whereby the uterus becomes very irritable, and you find that it keeps contracting, but it doesn't have a particular pattern. So it may be here like right now, and then after around 4 hours it may come back, then disappear until tomorrow. But for labor pain, you can't have it, you go and sleep. It will continue increasing until the baby really comes out.
Of course, it can't allow you to sleep.
Exactly.
It is a pain that you cannot ignore, right?
Precisely. You can't.
All right. So during the third trimester, again, most of the time a woman is tired. I remember for me, I was like, no, I want the baby to come at 37 weeks. But I know, what advice would you give women who are like, okay, I don't want to wait until 40 weeks. But so what are the benefits of waiting for you before or after 40 weeks? What are the benefits of having a baby at least at 40 weeks, 39 weeks, unless other factors have triggered you delivering early? But some moms like me, we are very impatient and are like, let this baby come, I'm already tired, especially if you've gone through a rough pregnancy.
You see, even as healthcare workers, gynecologists, doctors, midwives, what we do in terms of delivery is really to be your partner as a patient, to ensure that there is safe delivery for you as the mother and also for the baby. So we hardly really want to interfere with that process because it's a natural process. So we are standing there just like you, you have a baby, you're standing there to make sure that she's playing, she's doing whatnot, and you don't want her to get hurt. Putting it crudely, that's our role really. And we usually would not want to interfere. We would hardly want or induce labor unless there's a reason why we should deliver the baby earlier. If there's a reason to deliver the baby earlier, like maybe the mother has developed preeclampsia, that is high blood pressure in pregnancy, or has diabetes of pregnancy, or is having some unstable pregnancy, then we intervene and then we deliver the baby to save the baby's life at that particular point. But if the baby is fine, the mother is okay, maybe a few challenges because of pressures, a bit of stress here and there, a bit of discomfort, we would deal with those symptoms and wait for the baby to be born at the right time when the baby wants to come. A rider to that though is after term, that is after 40 weeks, we call it post-dates. After 40 weeks, we would generally advise and actually do induction of labor. So we actually deliver the baby. And that is scientifically proven and supported. After 40 weeks, there is hardly more benefit to the baby. The baby is already mature. Now there comes more risks to the baby and to the mother after 40 weeks. That's why after 40 weeks, we would wait like 3 days or so. Then we advise the mother when she gets admitted. We start the process of labor and delivery.
So let's talk about the red flag signs during the third trimester. And then also, are there some possible complications that are associated with the third trimester that might develop if a woman is not has not taken precaution, that might develop during the third trimester, affecting either the woman or the baby?
Yeah, as we said last week, the red flags, they also apply during the second trimester and third trimester. And we did mention, and I want to remind our viewers again, that high blood pressure of pregnancy, we keep talking about it because it's number 1, 2 killers of our women in this country and generally even worldwide. That is preeclampsia, high blood pressure in pregnancy, which causes eclampsia, which is convulsions, and therefore causing mortalities to the babies. So a danger sign would generally be very high blood pressure in pregnancy. But how do you know about it? It's generally like a lot of body swelling. Suddenly, a mother has added a lot of weight. You've been adding like maybe every time you go to the clinic, you're told you've added 2 kilos, which is okay, which is standard. Then you go this time and you're told you've added like 7 kilos within a month. That is a flag, a red flag really. And then you're having severe swelling of the body. Leg swelling, as we said last week, 80% of women, that is normal. It has no problem at all. It's normal really. But you find that apart from leg swelling, one is having face swelling. Hands are also swollen. You take the blood pressure, it is also high. You check her urine, she's passing a lot of proteins detected in that. That is one. And then number 2, we also talked about bleeding. That bleeding which occurs in second trimester is still a bad sign in third trimester. Any bleeding, that's what medically we call antepartum hemorrhage, which can lead to one of the other top killers in this country of women in pregnancy, postpartum hemorrhage. Postpartum hemorrhage, it basically means that bleeding during delivery, and especially after the baby has just come out. And a mother may bleed torrentially. And if not well managed, unfortunately, you can lose a mother at that particular time. The other danger signs still uphold, like the ones we talked about last week, about abnormal vaginal discharge, foul smelling, meaning there is an infection, and this infection is likely to go to the baby and affect the baby in a negative way.
All right. And as we wrap it up, maybe you can leave us with a few tips on what kind of preparation that women now should be doing in readiness for delivery.
Preparing for delivery actually starts from, it's like retirement.
When the baby has been, when conception has occurred.
Exactly. We're always advised that you prepare for retirement the first day you are employed. Yeah. So that is how it is. Like from conception, what plans do you have for your baby in terms of where do you want to deliver your baby? how do you want to deliver the baby, and all those decisions, which means also going to the clinic early enough and going for on schedule for those clinics, complying with the schedule, the medication, the supplements which you're given, and of course having a healthy discussion with your doctor in terms of your fears during the pregnancy, and ensuring that you do your bit about it, and also deciding in terms of where to do the delivery. Are you going to do it in a government hospital, in a private hospital? Do you have insurance? Because healthcare in this country, inevitably, money is involved. So you need to look at, do you have your share? Where can it cover you? Do you have any other insurance? Are you a cash payer? Which facility is safe for your delivery and you can also afford it? And going to the nitty-gritties with your doctor and trying to find out what are there chances that you may go for a CS, or are you planning for a normal delivery? And it's always good as a mother and as a family and as a couple to plan for financially speaking and all other logistics for a cesarean section in case there's an emergency section. And just to backtrack a bit, why do we have cesarean section? Most of the time, if somebody has never gone for a CS, it would most likely be an emergency. She has come in to have and hoping to have a normal delivery. We are monitoring, and then we realize suddenly the baby is getting tired, what we call fetal distress. So in that case, you find the mother is several hours to normal delivery. This baby cannot wait those many hours. So we take her in for an emergency delivery. So these are often unpredictable decisions which are made, split-second decisions. So in terms of family plan, a family or a couple planning for their delivery, they should look at all those extremes. Yeah. And from where I'm seated, the most important aspect of delivery is safety. Yeah. So whether it is normal delivery or cesarean section, paramount consideration is really safety for the mother and for the baby.
Yeah. Right. So that's the end of our pregnancy series. But of course, we'll get time and talk about delivery, talk more about CS, talk more about the normal birth. So make sure you subscribe to my channel, like, comment, and share to anyone who you think might benefit from this. I'll see you again on the next one. I'm 𝗙𝗵𝗶𝗺𝗏𝗃. Bye bye for now.